So it's really nice to see you for this town hall meeting today. I'm Helena Harnick. I am the Executive Director of the From Testing to Targeted Treatments program, and I know very many of you, so I'm happy to see you today. Today, what we're going to do, we'll follow the usual town hall format where we will be doing an update from the various working groups and activities across the program. You might recall if you joined the last town hall meeting that we've changed the format a little bit, and we're interested to hearing from you how you like it, but we will be doing a deep dive into one topic area. And today, thanks to popular request, we will be diving deeply into the precision medicine Synapse platform, and hopefully, if the internet is working for us, do a little demo of showing you what that is and how you can use it in your day-to-day work. But before we get in there, I will start with a quick overview and reminder of what we are doing. So if you could go to the next slide, please. As you know, the vision of FT3 is to improve patient outcomes by bringing to life the potential of personalized healthcare and precision medicine. And you will recall that we have a multi-stakeholder collaborative approach where we work with patient community as partners, but also with other stakeholders as well. And you have all the members who are closely involved in supporting the work listed there. And of course, there is a bigger community of practice, which also includes all of you. If you could go to the next slide, please. We have a quick reminder of the mission of FT3 and the different goal areas. FT3 aims to act as an accelerator in this area to capture global needs, learnings, and good practices to help precision medicine champions make impact on the ground and improve access to precision medicine when it could benefit the patient. And we are doing that through 3 goal areas. The first goal area, evidence-based precision medicine, is accepted by decision makers and available and accessible to patients. It's basically focused on how to enable access at the healthcare system level. The second goal area, activation of precision medicine at the healthcare delivery level, is looking at how can we ensure access at the healthcare implement more the implementation side at the care level. And then the final goal area is more about our mission, which is to unify and accelerate the precision medicine ecosystem. And on the next slide, you will see an overview of the different work streams that we have. And so the idea is that we will go through each of these today. Each line that you see is a work stream. And after we have the demonstration about the precision medicine Synapse, we will have a quick update from different representatives to see what's going on here. And here you see more a summary of the different system change goals and how we're working towards system change in 2024. In the interest of time, I'm going to let the individual work streams remind you of that when they present. What I wanted to do just to help set the scene is to share some initial highlights of what has been going on since the last town hall meeting. So it's difficult to synthesize it all here. We've had a lot going on. In terms of increasing uptake of FT3 tools and resources, we have some micropilots, we call them, of adaptable resources going on, and we have some new adaptations to share in breast cancer in Africa. We have a footprint in precision medicine that continues to grow. If you were joining us at the very beginning, you were hearing us talking about ASCO, but we were there and we made some great connections. And more recently, thanks to Dr. Stefan Gluck, we were also able to meet with the Chief Medical Officer of ASCO, which was a really promising meeting. In collaboration with 2 medical societies, the Spain pilot group has successfully conducted a webinar for patients and caregivers, highlighting some of the challenges that have surfaced in this pilot. We had some good news for the country pilot program overall. One of the abstracts that we had submitted about some of the learnings we had made has been accepted as a virtual abstract at UICC at the World Cancer Congress in September. We had several in-person workshop sessions at the Patient Engagement Open Forum this past May, and we will be sharing some of the outcomes and the update today. And you will be seeing, I hope, as you participate in these groups, that we have more and more representation from other stakeholder groups, such as the diagnostic industry and the medical community, and this is something that we continue to be very excited about. So when we share the slides with you after the meeting, we will include a summary slide that actually explains all of these in detail in case you want to share them with the communities you work in. But for the purpose today, we'll leave it at that, and then we'll move to the demonstration of the Synapse platform, and then again come back to a more detailed update across the work streams later on. So with that, I'm going to hand over, I think, to Vincent.
Yes, thank you so much,
well.
Elena. Thank you so much. I'm very happy to be talking about Synapse today. First, I want us to take a big step back and just think about the rationale and why we are doing these things without directly thinking about the topic. Nowadays, we're confronting a world that is increasingly complex, and with that, the societal issues that come up are likewise complex. And what we believe is that building and leveraging communities is really critical to deliver societal outcomes that can improve and address those issues that we confront. So precision medicine Synapse is one way of building and leveraging communities that can address those societal issues. And as you know, and as Helena alluded to, at FT3, we truly believe that multi-stakeholder collaborations are at the heart of addressing the manifold societal issues as they relate to precision medicine. And we want to deliver societal outcomes that benefit all stakeholders. For this, we're constantly looking to identify good practices, share learnings, and accelerate and replicate the best efforts in the ecosystem. Or in other words, we're gathering knowledge, we're building and leveraging networks, and elevating the precision medicine community. PM Synapse is a critical tool that we use for these efforts, and you can use it too. But before I dive in much deeper into the platform and bias you with all the great things that we'll be exploring together on the platform, I'd like to know what your ideal knowledge gathering and networking platform would be like. So for this, I'd invite you to have a thought, log on to the interactive tool, and let us know what functions, features, general functionalities you would like to see in an online platform that could support your day-to-day work and help you gather knowledge that you're seeking, network with other people and initiatives, and share the various great initiatives and works that you are doing. And I'll give you a few seconds to actually think about that and log onto the tool and give us some input. Intuitive, yes. Digital platform should be easy to use. There it is as well. Open access, real-time scientific advances. Very challenging to find and always be updated with the quick advances made in science. Very true. I see localized. Relevant topics. This is great. Huge. I really love the matching individual needs with case studies and best practices. This is a great one. Meeting people. See, there's still a couple of people typing. Balanced info. This is a really great input. Thank you so much. And I hope I can showcase a little bit how Synapse is addressing some of those. And of course, it's always a work in progress. So we'll take your suggestions very seriously when developing further the platform. Let me go ahead. So just to explain a little bit of the rationale of the platform itself, Synapse is a digital solution that helps us bridge gaps, fosters collaboration, and empowers individuals and their organizations to tackle the various complexities that we confront in our work. You can see here often what happens when we work is that we are kind of in silos and disconnected. And one thing that the Precision Medicine Synapse platform aims to achieve is establishing a connected ecosystem, something where we can see how we work together, where we can leverage our networks and really build on all the great work that is being done out there. This is only one instance of many. We have One Health network that encompasses various thematic areas. We will be talking about precision medicine Synapse, but on all of the ones that you see in the middle of the slide, you can explore the ecosystems around those topics based on condition areas in various countries. You can get reports on which initiatives are working on what specific area or unmet need. You can explore different events and even use your organizational space within the platform to manage your teams, interact, and so on. I will show you some of those things just in a second. Sorry, I'm juggling the screen. So the platform has various key functionalities and capabilities that you can make use of and explore. You see here the six major ones. We have established Synapse to be a mapping and networking tool overall. So whenever you interact with the platform and you search for and connect with different initiatives, organizations, people, events, and resources, you're contributing and making use of the mapping features that are incorporated within the platform. So one of the essential things is that all the content is linked with each other where the links are necessary. And of course, you have different lenses, as mentioned, the countries, conditions that you can use to explore it. At the same time, there is a knowledge sharing capability where your work can be highlighted, best practices can be showcased, and various resources shared, linked to each other, combined into one place where you can find great knowledge resources. This is, of course, for all stakeholders that work on precision medicine. And so it functions also as a connection between everyone that has an interest and works in the area of precision medicine. At the same time, there is a global event hub that can be leveraged to engage with precision medicine events happening around the globe. And an additional functionality that will come very soon is that a part of highlighting your events on the platform, you will soon be able to actually manage the events, allow signups, just like you signed up for this town hall meeting through the platform. In addition to that, there is three more key areas. One is the power mapping. So that really helps us understand the community dynamics and network structures, who is connected to whom, to what initiatives and resources. There is a co-creation support function, which helps you within your organization collaborate and share different insights that you have found on the platform. And then as an additional benefit, there is an option to have tailored solutions for your needs, your organization's or initiatives needs specifically. And this can be done by reaching out to us and inquiring about how specific needs can be met through the platform. There's a big update coming also. Right now, the platform, the One Health network, is separated among the various thematic areas. But later this year, there will be a beta launch that will combine all the different thematic areas into One Health network that will be truly One Health network, My Synapse, and it will be much more personalized by then. But before we go into that, let's have a quick look as to how the platform can be used. And for that, I invite you to think about just a normal process in your daily work. You log into your email in the morning and you see there's an update, a consolidated update email that says, oh, in my organization space on precision medicine Synapse, people have been active in the group space. So you click on it and you go into the group, which is what you should see on the screen now. This is the Synapse group space. As you can see, I am part of the FT3 organization and I'm in a specific group, the FT3 Advocacy Angels. And here we are exchanging different resources, views, links on advocacy and advocacy support. We have various options to do that. One is to link existing content directly in a message. Another one is to upload various files, media, and as such communicate with the members of the group, which can be seen here, including their functions. So there's also this kind of management component to it. In addition to the group space, of course, there is many more aspects that can be used. I don't want to go into the details of those, but really just emphasize that here the interaction is already quite high. We can react and comment on various posts, and as I said, share links as well as existing resources. So now I'm in my morning, I see this, and I see there is a great post about something that I should have a look at. So I'm thinking, okay, this is interesting. I'm clicking on it and I'm opening a new page. It leads me to a consolidated mapping space within Precision Medicine Synapse. In this case, it is advocacy toolkits. And here we can see directly in the beginning, there's various resources that have been highlighted. I can explore these either by going through them or by clicking on them and switching sites. Or I can go further down to look at this landing page. And here I can see, okay, there's an initiative linked to this page, which is the Access and Advocacy Project, about which you will hear more later, and additional resources that are listed here. There's only a selection that we can look at, or we can click and see all in a consolidated overview. In addition to that, the resources can also be filtered by using tags. So if I want to see only resources for patients, I can go and see, okay, this one is specifically tailored for patients, giving an additional insight into which resources can be useful for specific stakeholders. Then let's say I have explored this page. I want to look into one resource and figure a little bit more what this resource is about. So I'm clicking on it and I'm going into the page of the resource. In this case, the Transforming Policy Toolkit from the Global Colon Cancer Association. I have a section with information about the toolkit. I can follow the link to go to the website. I can download the file directly. And I can also see whom are the connections that are linked to this resource. In this case, it is Nicole Sheehan, the Global Colon Cancer Association, and various initiatives that have been associated with this tool. So now I'm interested to learn from an experienced advocate who can use this tool or explain me how I can use it. So I know Nicole Sheehan is linked to it, so I click on her and I go to her personal page. There is again various information that I can see about her bio. I can see the organizations that she is linked to, the projects and initiatives, the various events and resources that are relevant to her work and highlighted on the platform. In addition to that, while Nicole didn't provide any contact information to, for example, send her an email or similar, which is possible, there is a direct link to LinkedIn. And so we could potentially click on LinkedIn, connect with her right there. So before doing that, I go into the various connections that she has, because I want to have a clear overview of her connectivity within the precision medicine ecosystem. And here I see, okay, there's various other people that are linked to Nicole. There's various events and organizations. Now we can see, of course, FT3 has so many connections in this space. So if I double click on the organization, I land on the organization page. And here we have additional options to highlight various variables of the organization that can be useful for anyone who would like to interact with the organization. We have the network that shows on a world page and shows where are the most links in which countries. We have key contacts that can be contacted directly to make a link and establish a relationship with the organization. If we scroll further down, we see highlights that the organization signposted here. We have latest news, so the latest publications, for instance, or blog posts that are there. And then we also have all the people that are linked to the organization, which in FT3's case here is all members. that are linked. And then, of course, also the member organizations. So you see there's also a hierarchical option to link your members to an initiative or an organization and vice versa. The various projects that we run are highlighted under the initiatives. And then there's also events and resources that we can look at. So with this, I'm gonna switch back to our presentation. I hope this gave you a little bit of an insight into what the precision medicine Synapse ecosystem has to offer. And on this last slide, I just want to highlight that it's really easy to explore and try out the platform. You don't need to sign up to use it. You can just go and use the different lenses to find resources and events of interest. You can, of course, sign up and join or create your own organization. And it would be amazing if you have good practices and resources that you would like to share with the community, that you upload them and you highlight them to for others to see and make use of them or connect directly with you. With this, I'm encouraging you to let us know your questions, reactions, comments. Feel free to use the chat. Feel free to speak up.
I had just a comment to make, Vincent. I wanted, because I think some of you know a little bit about precision medicine Synapse, maybe haven't had the opportunity to dive a bit deeper, but it's an important support for the mission of FT3, because our mission is to accelerate efforts, reduce duplication of efforts, and also connect. And I think one of the things that we try to do is to try to look for best practices and make the existing best practices bubble up and make them more visible among the community. And this is why it's so important that if you have something that is a key learning or something that you have developed, that you are sharing that in Synapse or asking us to share it for you if you need some help, so that the rest of the community can benefit from that. And we also have big ideas for how we can continue to use Synapse. We have some ideas, for example, to enhance how you can look for different kinds of information according to the specific need you have, like the specific type of country you might be joining in from. So we will continue to develop this and would really appreciate your feedback as we do that. So I just wanted to add that to the overview that Vincent gave. And I don't know, Vincent, if there are people who want to have like further, more detailed demos, is that something that we can do?
Absolutely. Please don't hesitate to reach out to either of us or to the FT3 team in general. We'll be happy to explore the options that Synapse offers a little bit more with you.
There was a question from Muncie, and I just wanted to share it in case anyone else has the same question. So he was asking if more than one person from one organization be registered on Synapse, and the answer is yes, it's open to anyone and there is no limit. So we encourage you to get started. And if you need help doing that, just let us know and we can walk you through that.
Amazing. All right. So with that, we've gone through the little demo and we can move on to our first specific project update. We'll look at the activities to improve access to precision medicine at the health system level under goal 1. We are starting with the access and advocacy project. This is you'll still have to listen to me a little bit longer. I hope this will be an exciting update. Actually, with this project, we are aiming to support building the accessibility conditions for precision medicine at the system level. We realized that our role is to be a connector and an accelerator. So we want to facilitate the efforts of precision medicine champions in various countries to influence system level change in their countries, so that improved access can be given to patients. This year, we have co-created and defined an advocacy roadmap that will exactly do that and help people understand system level accessibility conditions and the readiness conditions that are needed to identify where change is most desirable, and then will also provide insights into which type of evidence can be used, how to package it, and how to present it then in the end to decision makers so that they can be convince to enact the changes that the advocates would like to see to improve patient outcomes. This is a very big step towards making our support for advocates happen. We have co-created 2 modules already, and we have gathered insights at the Patient Engagement Open Forum from more than 30 participants representing 5 geographic regions. And this is quite significant for us because they have confirmed the potential for this effort to reduce the burden that champions have in tailoring advocacy efforts in local contexts. If you want to know more about how we create these roadmaps, on what type of good practices we build, the various co-creation steps that we go through with our project group that you can see on the bottom of the page, you can explore the consolidated mapping of advocacy toolkits, which I have also just shown you on Precision Medicine Synapse. And there is a second mapping that is ongoing, which is around evidence for advocacy. So we're looking into finding good practice examples of using, for instance, real-world evidence, patient experience data to make convincing arguments that help change accessibility conditions for the better. We're very eager and curious to get your insights and expertise around advocacy best practices, but also around a specific use of evidence for advocacy. So please don't hesitate to reach out to us. Next month, we are conducting our first Value of PM Access and Advocacy workshop. This is an invite-only event, but we encourage you to reach out to us so that we can include you in that workshop, where we will look into how to support advocates in more detail with a specific lens of on the value of precision medicine. We'll bring up more details about this in a bit. If you want to get involved in the project, please reach out to Silvia at thesynergist.org. And with this, I will hand over to Ivica, who will give a more detailed update on what we achieved at the Patient Engagement Open Forum session.
Thank you, Vincent. In the interest of time, I will try to be as quick and efficient as possible. So we made just huge milestones at the Patient Engagement Open Forum in a way that we tried to match the advocacy roadmap modules that we developed with the readiness conditions in the countries. And that's why we had 36 diverse experts from the patient community, HCPs, from the industry, and not only from the pharma, but also from the tech companies and diagnostics companies. And we discussed what is the understanding of the national conditions and how can we adopt this and implement it in our own levels. Because the advocacy efforts are not one size fits all. We have very different backgrounds, and the important thing to say is that all these people were from 5 different continents. So we tried to make this fit for purpose models work as a fit for usage models. And I will just give you a quick taste of my small group around the table, because we found this understanding that different stakeholders from one country are not able to paint a picture of what the landscape of precision medicine in their country is. So we need to do some more research. What is important to say that this modules could help that people from different countries can find countries with similar conditions and use their best practices in their own environment. And the best takeaway is that we can actually adjust the efforts on advocacy of patient organizations in their own environments. So I would stop there and get back to you, Vincent. Thank you.
Thank you so much, Ivica. Yeah, it was really eye-opening to get the feedback from so many diverse people, and yeah, I appreciate your leadership, Ivica, in this effort. With this, Lidovai, I'll ask you to continue.
Yes, thank you, Vincent. Hi, everyone. I'm going to present to you a project what is named The Value of Precision Medicine. It has the ambition aim to really support the paradigm shift from so-called traditional assessments towards value-based care. And we started with raising awareness and knowledge among different stakeholders about novel elements of value. But what is it what you can consider that would help to understand the value that innovative therapies bring? So during our last town hall meeting, we presented to you our research findings, and we concluded that we see suboptimal uptake of these proposed innovative value drivers that capture the value of precision medicine. So next, we started to explore that further, building intelligence of novel approaches that are out there, seeing if we can try to accelerate and highlight those good practices. And also we are developing information sheets for champions to show what are those novel value drivers about, what is the associated evidence that's out there, and what kind of examples can we find from HTAs that are considering those. So for example, we have learned that the value driver caregiver and family productivity, meaning the ability basically for people to maintain work and daily activities, is considered by some HTAs. For example, ICER in the US and ITWIG in Germany are considering productivity in some cases. Whereas the value of hope is often harder to quantify and often less considered. But we have heard from the patient community that's really important to them and significant also in the precision medicine field, where these new innovative therapies provide optimism and quality of life for those patients. So we are now packaging those value arguments and co-create this further to really equip you and other champions with information for starting dialogues also with your national authorities, with your HTAs on the inclusion of innovative value drivers that are important to patients. And as Vincent shared, I'm really excited to join this advocacy workshop coming up. It's July the 18th, where we have as keynote speaker also Luke Garrison, former ISPOR president and father of the ISPOR Flower, which really will talk about those innovative value drivers. And then we will also share with you what we have learned. And with your support, we will co-create the arguments so we can drive more holistic value assessments. So if you're interested in attending, we have already quite a few people that registered, and we are open for anyone who would like to join. It's an invitation-only event. So if you'd like to join, please reach out to my colleague Vincent for your personal invitation. With that, I would like to emphasize that there is a need for a paradigm shift towards value-based care, but with that, we also need more evidence and data to support understanding those value drivers. And for that, we have started a new project around patient experience data, and my colleague Isha will share a bit more information on this project. So I would like to thank all the contributors for sharing your expertise on the value of precision medicine and hand it over to Isha on patient experience data.
Thank you, Lidovai. And hi, everyone. My name is Isha, and I'm a program manager at the Synergist. And my efforts in FT3 are mainly focused on supporting the needs to demonstrate the impact of personalized medicine on patient outcomes. The background on the patient experience data and precision medicine project is that we heard from the FT3 community that there is a need to accelerate the utilization of patient experiences in value assessments to help decision makers evaluate which healthcare interventions will ultimately most effectively address patient needs. We identified some gaps and needs in the ecosystem that hindered the integration in HTA decision-making. For example, limited guidance on how best to integrate patient experience data, fragmented approaches across patient groups in the collection of this data, as well as varied approaches across different HTA bodies in integrating patient experiences. Our potential goal is to capitalize the learnings of existing initiatives to support better utilization of PED in HTA decision-making for personalized medicine. As a first effort, we shared and gathered the learnings at a virtual POF session held in April with more than 100 participants from various stakeholder perspectives. And a key need that we heard that was emphasized from the community was to collect PET quickly and to use it quickly. For example, in the oncology space where lifespan might be impacted by the disease, and to exchange sustainable knowledge. It was suggested to document insights from HTA submissions and build intelligence beyond individual case examples. So as a next step and call to action, we would like to invite you to input and feedback the concept note for this project that will shape the 2024 and 2025 work plan. And if you are interested in this topic or would like to know more, we would love to welcome you to our PET and PM working group meeting, which will be held tomorrow at 4 p.m. CET. So if you want to attend, feel free to reach out to me on my email, and I would be happy to extend the invite to you. Finally, before I hand it over to Helena, I would like to thank all the contributors who have helped in building the momentum and defining the role of FT3 in the utilization of patient experience data for personalized medicines. So back to you, Helena, to introduce the Goal 2 project updates.
Yes. So if we can move to the next slide. So if you recall the strategy from the beginning, the Goal 2 project areas is to address access barriers at the point of care. And for this one, I'm actually not sure who's going to take the next slide. Eleonora, I think, is going to take the next one.
Yes, it's me.
Okay, so hand over to Eleonora. Thanks.
All right. So hi, everyone. Nice to meet you. My name is Eleonora, and I've recently joined the Synergist as a program manager as well. And within FT3, I support all the projects related to Goal 2, and especially this specific work stream that is focused on identifying the support needs of HCPs within the landscape of precision medicine to facilitate the adoption of precision medicine at the point of care. As Elena was saying, this project is very much aligned to FT3's overall vision to collaborate for a better outcome and to make precision medicine equally accessible for our patients. And so because we have realized that precision medicine is not yet a reality for a lot of patients, we've tried to understand, with this project, we aim to understand what are the challenges that the different HCP stakeholders face when it comes to proposing precision medicine options to patients, and what are potential support needs that might facilitate HCPs in their work and in their role of accompanying the patient into their care journey and making sure that the patient can be an equal partner within their care journey. So what we did for this project is we realized there was a lack of understanding within the landscape of the different stakeholders involved. And we also could not find a comprehensive overview of the different challenges within the precision medicine landscape. So if we could go to the next slide, we took a very simple approach, and here we wanted to show you an example of how we started this project. We started by mapping out what is the care journey that the patient needs to go through to eventually access precision medicine and benefit from it. And then within this journey, we mapped out what are the sub-steps, and here you can see just an example of how within the diagnosis phase, one of the things that need to happen is communicating this diagnosis to the patient. For each of the HCP stakeholders involved in the process, we then mapped out the role that they have in that specific step. And that allowed us to then move forward into understanding what are their challenges and support needs within the environment. So Vincent, you can click one more time. Starting from these challenges and support needs, we then went into the broader ecosystem and tried to understand if there are already some actors that are acting to somehow address the support needs. So as an example, the oncologists are struggling a lot in communicating results of biomarker testing to patients. And we found a good example that, Vincent, you can show. By clicking, we found a good example that is coming from the Australian Pancreatic Cancer Genomic Initiative, where there is a guide that is released for oncologists to understand how to interpret and patient-friendly communicate results to them. We also found a very cool point of connection within one of the existing projects in FT3. So we are also working on a similar initiative to make patient-friendly reporting available. Similarly, for pathologists, there is a good initiative that is called for Onco Community, and there is basically the opportunity to have a group that through peer-to-peer support allows for pathologists to get consultations and support in interpreting testing results. While for nurses, instead, we did not find anybody addressing their challenges, and we actually struggled to understand also what is their role in every single step. And so definitely we identified the room for improvement in that specific landscape. So going back to the next slide, this was our preliminary work. And what we expect, what we've learned so far is that generally there is a fragmentation within the landscape that does not facilitate the interaction within the HCP's team. And that also makes it harder to share knowledge and intelligence for better patient outcomes in the end. We also found that there is a clear correlation between the genomic confidence of the different HCPs and their tendency to propose and promote precision medicine options and treatment options to patients. We understood that there is a huge potential in the role of pathologists and the way that they can support oncologists, and we also understood that there is a lack of understanding when it comes to nurses' challenges and support needs, and so we definitely identified an area of work there. So these were some initial findings that we thought would be interesting to share with you. And within the next quarter, what we plan to do in this project is to validate this mapping by involving key experts, and then identify unmet needs by convening a group of multidisciplinary HCPs, so that then we can start brainstorming solutions. In terms of call to actions for you, so support that we could really use from your side, this mapping will be soon available on Synapse. So we would love to hear your thoughts about that. And we would also love to understand from you if you have ever heard of existing good practices within this ecosystem to support HCPs in aligning and in adopting precision medicine at care level. We're also trying to involve as many diverse stakeholders as possible. As an example, we recently had a discussion at ASCO with some leaders from medical societies, and we aim to keep on involving as many diverse stakeholders as possible. So if you also have any inputs on people that you believe might have a valuable contribution for the project, we would appreciate that. And again, if you have any inputs or any lived experience that you would like to share with us, we would love to hear it. So I would ask you to please connect with Sylvia. That's the same email that was shared before, sylvia@thesynergist.org. If you'd like to contribute, we'd love to welcome you in the team. And now I will hand it over to Osioma that will talk a bit more about another initiative that is part of Goal 2.
Thanks, Eleonora. Hello, everyone. My name is Osioma, and for this specific project, the Adaptable Resources, I support FT3 collaborators with adapting educational resources for patients. So the goal, please can we move to the next slide, the slide for the Adaptable Resources? Okay, thank you. So the goal of the Adaptable Resources is to promote patient awareness and understanding of precision medicine. To achieve this, we developed 3 key resources, namely the question to ask your healthcare provider, targeted therapies for cancer, and biomarker testing for cancer treatment. These resources are designed to be easily adaptable in order to enable patient organizations provide information without having to start from scratch. They can also be used in clinical settings as supporting aids for both HCPs and patients to facilitate shared decision-making. During our last town hall, Dr. Navdeep spoke about our collaboration with Colorectal Cancer Canada and Queen's University Hospital in Canada to pilot 2 adapted resources in clinical practice. And through this pilot, in other words, implementation study, we aim to create a replicable blueprint for integrating PM-tailored educational materials into clinical practice. We are also currently collaborating with Project Pink Blue to adapt the 3 educational resources for breast cancer patients in Nigeria, and with the AMAL Association to adapt the targeted therapy resource for CML patients in Morocco. In a moment, I will hand over to Ronsi to shed more light on the resources adapted for Nigeria and their potential impact. But before doing so, I'd like to mention that we need your support as a community to promote these resources to local precision medicine champions. You could support by emailing your contacts to inform them about these resources and their local applications. You can also share the full suite of the resources to your network, including all their language translations. So if you'd like to get involved, perhaps you are interested in adapting one of these resources, you can contact me via email and I'll be very happy to support you. I'll now hand over to Ronsi to share more details about the resources adapted for Nigerian patients. Over to you, Ronsi.
Okay, thank you very much. Yeah, so I'm really delighted to share what we have been working on for the past few months. The good thing is that I strongly believe that these adaptable resources will be sort of a good opportunity to really help our patients to keep tab of the kind of question that might be helpful for them to ask their patient. The problem is because of the challenge of when patients really go to the health facilities, sometimes they have questions that they really want to ask. Sometimes they have idea of what they want to ask based on Googling, based on relying on Dr. Google, you know, asking and reading all these things. However, when they get to the facility, they totally forget all these questions that they want to ask, or they forget these issues that they want to bring up. Having a material that is really crucial like this, especially on precision medicine, will help the patients to really keep tab and take note and probably find crucial questions they could help to ask their healthcare providers. And what I like about this is that we are really working on this from a bottom-up approach, working with the patient to pilot these, know what they think about it. We're also including survey and qualitative feedback from the patient to know what they think about this, what they think we can improve on this. So the first pilot, we're hoping to distribute that, working with the actual facilities across the country and not working with maybe the high-level organization. So we want to ensure that this gets in the hands of the patient and hear what their feedback could be before we continue other national dissemination. I would just say thank you so much to Ozioma and Sylvia and the rest of the team at FT3. They've been really helpful. After this project, we're also hoping, we're currently working on the country condition card, which we think will be also very valuable in knowing what exactly we have in the country in precision medicine and what need to be done, and also providing a sort of a resource database where people who want to partner with Nigeria could really know what is available and what needs to be improved on. Thank you.
Thank you so much, Ronsi. Very exciting updates from Nigeria. I'll continue with a quick overview of the last activity under Goal 2. We are looking at biomarker test reports and how to make them more patient-friendly and enable providers to give a results disclosure that is understandable and useful to the patients to enable shared decision-making. With this, which we have presented several times already during town hall meetings and other meetings, I want to highlight that we are moving into the finalization stages. We have received in the last final round of consultations valuable insights that help us to make the tool fit for implementation, preparing for upcoming pilot opportunities. And we've also started getting the word out about the tool to identify further use cases that could help providers, including pathologists and oncologists, to improve their results disclosure in a patient-centric and patient-friendly way. You can explore the blog post that we have published on the focus groups with patients online on Precision Medicine Synapse. With this, I'd like to give our partner Paola from Argentina the opportunity to share a little bit about her plans to pilot this tool in her clinic and understand better how it can serve oncologists in Argentina.
Hello everybody. I'm sorry I have a sore throat, so my voice is a little bit funny today. So what we are doing right now is we developed a new NGS template for reporting our lung cancer patients' results. that is a little bit more friendly. This is part of a project, and we used some of the items proposed by FT3. And our plan is to test this new format and compare it with our old format before moving forward to a new version of our NGS report. And the way we're going to test it is by running a study with oncologists, with clinical oncologists, on what do they understand about our report. So we're going to do a little experiment with them, getting them to read and interpret some reports and to see what conclusions can we gather from that in order to, iterate a little bit of the version and improve it, because we are kind of worried on what do oncologists understand on what we write. So we are in the process of getting a friendlier version of our reports, taking some of the suggestions that FT3 has made on the biomarker test report.
Thank you so much, Paola. It's really exciting to hear this progress and the way FT3 empowers some of your efforts. Yeah, I'm really looking forward to continuing this collaboration. Yeah, it also underlines the adaptability of the tool. So happy to discuss with anyone how this could be used to inspire further adaptations. With this, I will hand it over to Lidavai, who will talk us through some of the country pilots updates.
Yes, thank you, Vincent. I have the honor to share with you a unique program. We talk now a lot about tools and global learnings and things that are available. Here we're really looking at supporting local champions and advocates to really improve access on the ground. So it's really like doing the groundwork, bringing also the local people together in a multi-stakeholder group and sharing that we're again globally in a community of practice. So we have started, as you may know, in 3 countries, Spain, Hungary, and the Philippines, and are exploring a pilot in Japan. Each of these countries has a unique access archetype. So for example, in Spain, it has a decentralized healthcare system. It's in transition from a privately funded testing system to more public reimbursement, with also a broader biomarker catalog. And in Hungary, testing is reimbursed, but often healthcare professionals and patients are not fully aware about the different options. In the Philippines, we have a public-private healthcare system where testing is largely out of pocket or supported by manufacturers. So each of these archetypes have a kind of different strategy that is needed to advance access. So that's what we are piloting in these country pilots. And the learnings of this will be shared with you also in a community of practice and can be used by others who are in a similar kind of situation. So today we'll give you a sneak preview of the progress and the approach in each country. And if you'd like to learn more, reach out to me. Happy to share the information with you. If you like to perhaps kickstart a country pilot, we are happy to explore the options and partnerships to also support other countries in driving access. So with that, I'd like to thank all the people who do all this groundwork and all the partners, and I'd like to hand it over to one of our local partners, Begoña in Spain, to share the work of the multi-stakeholder group in Spain. So Begoña, I'm handing over to you.
Thank you so much, and hello everyone. I'm Begoña Colmenero, Precision Medicine Lead in MSDS Spain, and I'm glad to be here today to share with you, on behalf of the Sabio Mares group, an update on the progress and next step of this pilot in Spain. Let me first of all remind you that the long-term goal of Sabio Mares is to reduce disparities in access across Spanish decentralized system, as we were mentioning, by meeting patient information needs and supporting decision makers with optimal implementation of biomarker testing in all regions. Along the long-term goal of meeting patient information needs, the team aims to increase levels of understanding of precision medicine solution among lung cancer patients which has been addressed with a webinar that was hosted by the patient advocacy groups and with the upcoming dissemination of the adapted educational materials for patients that are currently under review by a medical professional. This webinar was designed to raise awareness and knowledge of patients and caregivers around biomarker testing and targeted therapy in lung cancer and their rights to demand and get reimbursed for these options. In collaboration with two representatives from the Spanish Pathology Society and the Spanish Lung Cancer Group, which concrete explanations were provided to more than 100 attendees who signed up in the webinar. And there was a high level of participation among the attendees, reflected in many questions before, during, and after the webinar that has now become available as an online resource for people that are now dealing with lung cancer, and visualization of this recording continuing to grow. Additionally, the medical oncologists who participate in this webinar is now reviewing the adapted educational materials to guarantee their accuracy, and this also showcases the power of this activity to nurturing key contacts with the medical community, enabling the project to ensure continuity in the activities. To support decision makers in improving the implementation of biomarker testing included at the recently approved catalog, the pilot team has also confirmed a strategic approach of conducting a regional roundtable as a proof of concept in Andalusia, one of the regions in Spain, with the help of a local agency. And now we are starting to outreach the relevant key stakeholders that should be included in this roundtable. And we are thinking of policymakers, medical key opinion leaders, and also some civil society players. To sum up, the Saviomares team is now endeavoring to improve or to provide, the adapted educational materials to the patient community. And we are also exploring the potential for the medical community in Spain to make use of them as well, to reach more patients, and also to plan a successful roundtable that has impact on the system level. All this point, the team aims to leverage. At this point, the team wants to leverage its network and the agency's support to gather decision makers and medical key opinion leaders, which will enable the development of concrete content for the roundtable and establish it as a proof of concept of multi-stakeholder collaboration towards improved implementation of precision medicine solutions here in Spain. And with this, I would like to hand over to the Hungary team that are also going to share their conclusions from the pilot.
Thank you. My name is Erika Pataki. Oh my goodness. At the moment, are you hear me?
Yes, it's better now.
Yeah? Okay. My name is Erika, and I part of the LELEX. That's a nice pleasure for me. I show for the Hungarian team work the last period, you know. The long-term goals is not changed. We want to improving the patient awareness of the biomarker testing among the patients with the adapted materials. And this year we are focusing the main two key things. We are delivering and expand the awareness of this resource among the healthcare professionals and the patients in the rural areas. And other hand, mainly the gather additional information on the system and the care level barriers in Hungary for the patients and assess the biomarker testing and the targeted therapies. This goes beyond the patient education and the awareness barriers that we have targeted through the Hungarian pilot so far. And unfortunate, arrive at this project to contribute the nice molecular pathologist from the National Tumor Board and some other highly experienced oncopulmonologists. And from these dialogues, we have been able to conduct, so far we uncovered the following key barriers at both system and care levels. At the system levels, that bubble up so far is the overall low investment in the healthcare from the government and lack of national cancer plan on facilitate the integrated implementation of cancer care in the country. Also, the fragmentation of the healthcare budget allocation creates sustainability issues the system. It also causes significant regional differences in the quality and availability of the oncology care, leaving most of the population in the high unmet need. And we have some interesting reimbursement process takes a significant amount of time, up to 48 months from approval to reimbursement. Due to delays in the reimbursement system, the majority of the patient currently access treatment through the individual request. And the care level, some of the things that emerged are, we have differences between the rural and the urban areas, term of access and the quality of care were highlighted here as well. For example, there are not many molecular centers of the country, which creates the issue in terms of TATs, and the histological performance is not optional in the small labs, and the oncologists do not request biomarker testing as often as they should need more education for the oncologist. And there is need improving the education of the general practitioners for improved the symptoms identification. This was the brief about the Hungarian pilot. What do you think? May I lose something important? Yes, we try share this materials, is lots of distributing forms, you know, the clinical centers and the congress, and we try to share everywhere in the country, not only main part of the oncological center, the rural area as well.
Thanks so much, Erica. I think with the time we have left, we should move over to the next one, which is the last update from the Philippines. And with that, I'm going to hand over to Isha.
Thanks, Helena. So in the Philippines, we have a very diverse multi-stakeholder group that has identified an overall need to demonstrate that patient outcomes for lung cancer patients can be improved in the Philippines by improving access to biomarker testing. We started with a patient journey mapping to understand the gaps and needs with the support of the Access Barrier Cause Effect Canvas tool, which revealed that there is a need to address the delays in the test around times for time-sensitive shared decisions on treatments, starting with capacity building support for healthcare providers and adapting fit-for-purpose information for patients. There is also a need that was brought up, which was to influence the legislative advocacy efforts on a system level for reimbursements and ultimate access to testing. It was decided by the group to start efforts in one hospital, and as an immediate next step, it was proposed to address the test turnaround time with education efforts and to potentially influence conversations at the molecular tumor level, tumor board level, to transition from retrospective to more prospective discussions. If any of you have experience in this field or would like to be involved in any other efforts, please reach out to Maximilian, who is leading this work. I would lastly quickly like to invite our patient representative, Engineer Emmer, who's joining from the Philippines at 11 p.m. now his time, in case he would like to add a short comment. Engineer Emmer, would you like to add something?
Yes, but I'm not prepared to say anything. What I can share is that it should be done. The advocacy should be done. simultaneously preparation of the healthcare providers and addressing the barriers at the same time, pushing for legislation so that it will uh, the cost of the biomarker testing, which is quite expensive here in the Philippines, may be shouldered by the government healthcare insurance. Thank you.
Thank you so much, Engineer Emmer. Back to you, Helena, for the next steps.
Thanks, Isha. So first of all, I want to thank the community and for the members for all their support. It becomes increasingly difficult, as you can see, to keep the update under 1 hour because there is just so much to share. It makes me very happy to hear all the different kinds of updates and learnings coming from this. If you could just move to the very last slide. I wanted to finish by just summarizing again the different ways you can get involved. So in addition to the project group meetings where you can participate in the discussions as we have been having today, there is also the option, if you're interested in participating at another level, to consider membership of FT3. At the FT3 membership level, you can participate at another more strategic level, such as in participating in the Strategic Advisory Board. We'll have the next Strategic Advisory Board right before ESMO this September. I also wanted to invite you to reach out to us if you will be attending ESMO or some upcoming conferences like the World Cancer Congress in Geneva the week after ESMO, and also to continue to share with us any ideas for improvements. We love to hear from you, and we're always thinking about ways to improve these interactions. And one example we had this, or idea we had this morning, was to think about a wider community of practice moment when, in addition to these town hall updates, that we might be able to have a place and time where actually you from the members of the community could also share the work you are doing and to share the learnings you're having and maybe the questions you have for the community. So we'll continue to think about that, and we'll look forward to hearing from you with feedback you might have about that idea. So thank you again. Thank you those for staying a little bit late. Apologies again for running a little bit over, and we hope you have a wonderful rest of the day wherever you are.